go. Let me see here. Speaker view. Bam. There we go. Okay, beautiful. So let's see here. We'll close that. There we go. All right, let's get started with training, guys. If you don't know my name and you don't know who I am, or if you're watching this video, my name is Tony Martinez. I am the owner and founder of TKO Financial Network. With us right now is about 25, I believe. Well, we're about there. 25 either agency owners or agents. These are individuals that run their own operations and they're leveraging TKO as their back office support system. Some of them run agencies across the country. Some of them are independent agents. But today's training is going to be on health insurance and how to cross-sell health insurance and be able to obtain life insurance sales, critical injury sales, and living benefit sales. I'm very, very, very big about people understanding that before you can run a bakery, you first got to know how to sell some bread. You got to learn how to bake bread before you can run a bakery. And so, one of the things you'll notice about me is that I am not in any way, shape, or form about doing things in reverse. There's organizations that'll teach you first how to build, and then later on down the line, they teach you how to sell. I want to teach you how to sell. And I believe wholeheartedly that if I teach you how to sell, you'll build enough confidence that you'll want to build because you'll have the tools and resources and you will be your own edification. I'm not telling you that it's not important to edify, uplines and sidelines and successful people in the industry. Right now, I partner with an individual that runs a company called Ace Financial, and he runs an amazing operation in the e-commerce space. And I take my time to edify who he is before I bring a qualified candidate in, because quite frankly, he knows more about that space than I do. But I made sure before I went out there and started talking about e-commerce that I had enough ammunition in my tool belt to be able to answer 80% of their questions before I teed them up. And so that's what I plan on doing today with you guys. I plan on giving you those tools. So first, let's talk a little bit about how health insurance works, right? Let's talk about that. We're then going to talk about what's called the Affordable Care Act program, right? Because it's hard to market. It's very hard to market health insurance if you don't know anything about it. Even though, yes, the idea here is to help them with their health insurance, but also cross-sell life, you got to know a little bit about health insurance. You got to know a little bit about the Affordable Care Act program, because that's what makes this cross-selling opportunity even exist. So, number one, talk about health insurance. Number two, talk about the ACA program. And then number three, we'll talk about the goal, which is cross-selling. Okay. Let's talk about health insurance. What exactly is health insurance, right? It's insurance to pay for your medical bills and your doctor's visits and so on and so forth, right? There's a couple things that almost every health insurance plan has. First is a monthly payment, right? A monthly premium. There's a cost. You got to pay that monthly. Second is a deductible. Deductible is typically some type of lump sum dollar amount that you need to pay before the company starts to cover a percentage or all of the medical expenses, right? And I'll break it down and give you kind of a scenario as well. Third is a copay. Doctor's visits, prescriptions, things like that. There's typically a flat fee that you have to pay in order to get those types of services, right? Fourth is a max out of pocket, meaning what's the most that you will pay in a 1-year period before the insurance company covers 100% of all the costs. 100% of all the costs, okay? Then there's what's called a spread. And a spread could be an 80-20, could be a 70-30, could be a 60-40. We'll talk about what that spread is here momentarily, okay? So how does health insurance work? Number one, you're going to get a monthly payment. Let's just say this particular plan that we quoted for the client costs $200 a month. Okay, it has a $2,000 deductible. It has a $25 copay plan, The max out of pocket is 4,000. And the spread is an 80-20. It's kind of what you'll see. What exactly does this all freaking mean, right? So the monthly payment has to be paid every month no matter what. This is your cost of having coverage. You got to pay that every month, no matter what, okay? Your deductible is what you have to pay if you have to have a major procedure done. This isn't like a doctor's visit type scenario. This is, I need to get a major procedure done, okay? You know, a surgery, something. I got to get something done. And therefore, outside of this monthly payment that I need to pay every single month, I, in addition, need to pay $2,000 of the costs before this spread here begins. Okay. What that means is, in this scenario, I'm the client. I pay $200 a month. Let's just say I have to have a procedure done on my foot because I broke it or whatever. I got to come up with $2,000 first. And then the insurance company will pay 80% of the bill. I'm going to be responsible for the other 20% of the bill. So if the bill ends up becoming $3,000, right? Let's say the bill is a total of $3,000. The first $2,000, the deductible will come from me. The remaining balance is $1,000. They're going to pay 80%. I'm going to be responsible for 20. 80% of $1,000 means they're going to pay $800. I still have to pay $200. That's what an 80-20 is. Now, where does this max out of pocket come into place? Max out of pocket is the combination between your deductible and this 20%. Once the 20% reaches, once the 20% plus this deductible reaches this max out of pocket number, 80-20 no longer exists, and now it's 100% covered by the insurance company. Does that make sense? If it doesn't, unmute yourself. Let's have a dialogue. Let's have a conversation about this.
Can you repeat it one more time, Coach?
Yes, sir. I will give you this disclosure. This is not the way all of them work. This is the way how 70% of them work. I'll talk a little bit more about how the other 30, but 70% of them work this way. You have a monthly payment that you got to pay. This number will never have anything to do with any of these numbers. You just got to pay it every month. You got to pay it every month. Then you've got a deductible, which is typically the dollar amount you need to pay in lump sum before services are provided. Major services, not a doctor's visit because I have a flu, not, you know, I got some allergies, I'm getting nothing like that. I got to go and get an actual procedure done. $2,000 first has to get paid out of my pocket. Once the $2,000 is paid out of my pocket, then the company issues your spread, which is typically an 80-20, a 70-30, a 60-40. If it was an 80-20, that means that the insurance company is going to pay 80% of the bill. You're going to pay the other 20%. So let's just say again, in this scenario, it's me. I'm paying $200 a month and I got to get a foot procedure done because I broke my ankle. I got to get a procedure done. That's a major situation, right? The doctor's going to say, hey, Tony, you got to pay $2,000. Then we'll do the procedure. When they do the procedure, the total bill was $3,000 in this example. If the total bill is $3,000, I just paid $2,000. So you know that right off the bat, out of this $3,000 bill, $2,000 of it I already paid. That leaves me a remaining balance of $1,000. This insurance pays 80-20, which means the 80% of this $1,000 number is going to be paid for by the insurance company. So the $1,000 remaining, the insurance company will pay $800 of it. The other 20%, which is $200, is my responsibility. Now, how much longer do I have to continue to pay this 20% until I reach my max out of pocket? When I reach this dollar amount, in this scenario, the dollar amount's $4,000. Where does this $4,000 come from? It comes from your deductible plus these 20%, these 20%. Once that number reaches $4,000, there's no longer an 80-20. It's now 100% the insurance company that'll pay the rest of the bill for the remainder of the year. And then January 1st, it resets itself. Does that make sense? Okay. Now, I talked about this, and this. I didn't talk about copay. Copay is how much I pay if I got to go to a regular doctor's visit or a walk-in clinic or prescriptions. Let's just say I didn't break my foot. I'm paying $200 a month. I didn't break my foot, but I'm experiencing flu-like symptoms. I've got fever. I've got a cold. I've got a sore throat. I'm weak, right? In today's world, people would say, "What? You got COVID, right? Go get tested." That's okay. Let's use real world. Let's talk about real world shit, right? Excuse my French. Just recorded that. It's pretty cool. So what happens? I call the doctor. The doctor says it's not an emergency. You didn't break anything. You didn't, you know what I mean? It's not like you got into a car accident. Go see the doctor. Schedule an appointment with the doctor or a walk-in clinic. My insurance has a copay plan, which means I got to pay the doctor $25 to see me for that doctor's visit. This $25 does not count towards my deductible. It doesn't count towards the 80/20. Be quite frank, deductible, spreads, max out of pocket, all of those are only for major programs, major procedures. This $25 is just my cost to go to the doctor. Sometimes you'll see like it'll say, sometimes it might say something like this, $25.50, which means it's $25 to see your primary care physician and it's $50 to see a specialist. But at the end of the day, your only cost for that doctor's visit is your copay. If they prescribe you prescriptions, then you're going to also have some type of a copay plan for the prescription, like generics are $5, where specialty drugs are $25. Does that make sense? Okay. This is how 70% of all insurances operate. 70% of them operate this way. Okay. You're going to hear terms like HMO, PPO, EPO. The only thing that each of those mean is it means it's a network of doctors that accept that particular plan. HMO stands for Health Maintenance Organization. You're still going to see a deductible. You're still going to see a copay. You're still going to see all this stuff. But you can only use this insurance with doctors that accept that HMO. HMO is a preventative healthcare provider, which means in order for the doctors to give you services, you are required to go in regularly for routine checkups. You are required to do that. In order for you in an HMO to go see a specialist, your primary care physician, your doctor, your PCP, needs to refer you to that doctor. You can't just go. You got to get referred in. What's the pro to an HMO? It's really, I don't want to say a pro and a con. I don't want to say it that way. I want to say what's the difference. You're going to find HMOs much more used in low-income poverty type environments than you will wealthier neighborhoods. You will. You'll see a lot more doctors accepting those types of programs. A PPO, which is a preferred provider organization, okay, that's a different network. You don't need to get referred to go see a doctor or a specialist. You just go. You just go. It's not a preventative health insurance that requires you to go in for your physicals and stuff like that. You don't have to go if you don't want to. You could just make your monthly payments and kind of go, right? And a PPO has an in-network and out-of-network cost, which means in-network means the doctor that you're going to accepts that particular insurance. Out-of-network means the doctor you're going to doesn't accept that insurance, but the insurance company will pay something. Typically, in-network is cheaper than out-of-network. Okay? EPO, kind of a newer type of a program. Hang on a second. Somebody do me a favor. Refresh my memory, type in EPO and tell me what the E stands for. Okay, I think it's Executive Preferred Organization. Don't quote me on that, but someone find out. I know exactly what it is. I just don't remember the name of what E stands for. If you know what it is, enhanced. Okay, so instead of a preferred provider organization, it's an enhanced provider organization. EPO just means that they will only cover in-network. They don't have an out-of-network coverage. So a PPO says, hey, listen, we have two types of price points. If you go in network, it's going to be your lowest. If you go out of network, we'll cover some of it, but not all of it. And EPO says we only cover in-network. So if you're going to a doctor that's not in our network, we're not covering nothing. We're not covering anything at all. Does that make sense? Okay. 70% of insurances will fall into this type of insurance, and they'll either be an HMO, a PPO, or an EPO. The other 30% fall into what's called an HSA, a health savings account. An HSA has no copay. Because they have no copay, they can't go to a doctor and pay a copay for the doctor's visit. They can't go to an urgent care and pay a small copay for the visit. All they have is a deductible, a max out of pocket, and a spread, which means the client is going exclusive. Okay, which means the client is going to pay their monthly payment, but it doesn't matter if they go see a specialist. It doesn't matter if it's an emergency. It doesn't matter if they just go to their primary care physician. They've got to pay this deductible first. So a doctor's visit with a copay might be $25. A doctor's visit with an HSA might be $100, $110. Now, the good news is that $100, that $110 does count towards this deductible. So you'll see your deductible balance reduce. You'll see it reduce. Where, in my opinion, should a person get a PPO over an HSA? I'll tell you, somebody super healthy that doesn't see the doctors often would typically lean more towards an HSA than they would a PPO. Because here's what I will tell you. If a PPO costs $200, an HSA probably costs $120. HSAs are notoriously known for costing less per month because they don't offer any copay, because you got to pay the deductible first. HSAs are great for people that are healthy. I'm healthy. I'm a perfect candidate for HSA. I don't have any medication that I got to take. I don't have any, pre-existing conditions. I go to the doctors maybe once every 2 years. If it's not just a regular routine checkup, HSA is perfect for me. The other benefit to an HSA is that whatever I pay towards the deductible is typically a tax deduction. I can write it off on my taxes. On a PPO, you can't. Where does a PPO make sense? Or an HMO or an EPO? It makes sense for someone that goes to the doctors on a regular basis. The person that goes to the doctors on a regular basis because they need prescriptions, because they got to get checked up, because they have pre-existing conditions, any of those three is going to be the best option for them. As long as the doctors that they need to go to accept that network, whether it's an HMO or a PPO or an EPO. But they just know that they would prefer to have a copay than have to pay the deductible because they're going to go to the doctors. Does that make sense? Okay. Yes. If you're a business owner and you need a write-off, HSA might be a good route, because you can add money to the HSA account without necessarily having the medical expense. Literally, you would open up a savings account. It would be considered an HSA savings account. You'll get a debit card for it. And if you want to make a contribution into it, you can make a contribution, and that money now that's in there is a write-off as long as you use that money for medical expenses. If you don't show receipts that you're using it for medical expenses, then you don't get the write-off. What a lot of people will typically do is they'll say, hey, I'll pay the medical bill first, and then I'll put the money in the HSA, and then I'll reimburse myself, right? What the wealth of America will typically do is they'll just funnel in a bunch of money into the HSA, and they'll get the write-off, and they know that that money will be sitting there for any future medical expenses. However it is you want to do, just understand how they work. One of the reasons I love to record these trainings is because I'm not expecting you to understand everything that I just trained. But if you definitely want to learn this industry, I'm expecting for you to watch this video a few times and run some numbers on yourself. You want to know how you want to run some numbers on yourself? Go to healthsherpa.com. Healthsherpa.com. And just run some quotes. Run some quotes. Put some numbers in there. Run some quotes. See how much it costs you. Couple statistics about health insurance. Health insurance typically costs more for women than it does men. Anybody know why? One reason.
Because they go to the doctors and we don't.
You're right. They're smarter than we do.
It's the opposite for life insurance.
You want to know what it is?
They can have babies.
Paternity.
You can have kids.
That's right. Women bear children. Because women bear children, they have a tendency of having more medical needs than men do, right? And so health insurance costs more money for women than it does for men. Life insurance costs more money for men than it does for women because men have a statistical probability of dying sooner than women do. Disability insurance costs more for women than it does men because childbearing as well. Those are just facts, statistical facts, but you should know this type of stuff, okay? Now that I and honestly, what I just gave you is like a health insurance 101. There's other rules and regulations and things that you would need to learn. The people you would want to talk to about stuff like that, I'm going to give you 2 names if you really want to learn about that space, okay? Rob Raw, he's actually on the training here right now. He comes from the health insurance world. He understands it up and down, left and right. And the second person would be Howard Rabinowitz. Those are your 2 go-tos if you really want to learn about health insurance. Okay. Everything that I've talked about thus far is considered major medical insurance. There's another one. There's another one that looks, feels, and seems just like this, except it has a prerequisites that you have to qualify for, which means you could be denied. And that's called short-term medical plans, STMs. Okay, we've talked about HMOs, we've talked about PPOs, EPOs. Those are all major medicals, what that's called, major medical insurance. Short-term medical has this same feel, monthly payment, deductible, has the same feeling, except they can deny you because of pre-existing conditions. Major medical plans cannot deny you for pre-existing conditions, but short-term medical plans, they can. They can deny you. They could say, listen, we're not going to cover you because of this pre-existing issue. Or they're going to say, we're going to cover you, but we're not going to protect, we're not covering anything that has to do with this pre-existing condition. So someone who's diabetic and picks up a short-term disability, a short-term medical plan might not want to do that because the insurance will cover them for everything except for anything related to diabetes. You know, or someone that has a history of a back problem that needs to go in for medication constantly, or it won't cover. Short-term medical plans, so you know as well, they don't cover specialists. So psychiatric support, substance abuse support, pregnancy, none of that stuff is covered. Short-term medical plans do not cover that, and they don't cover pre-existing. They're called short-term medical plans because typically every 6 months to a year to 2 years, that's what I've seen thus far, right? 6-month plans, 12-month plans, 24-month plans, they need to get renewed. And if you didn't have something before, and then somewhere along the line you had something happen to you, you could not qualify for the renewal because of pre-existing conditions. Does that make sense? Where do I sell short-term medical plans? I'll tell you where. When someone who's healthy yet is at an age where they're higher risk and they want to cover, mom, dad, brother, like it's a family plan. If the major medical plan is too expensive, a solution is a short-term medical. If like, for example, if you run a major medical on me right now, if you run a major medical plan on me right now, it's going to probably run about $250 a month for me. But if I run a short-term medical plan on myself, they probably pay $120. It probably only costs $120. Why does it make sense for someone like me? Again, I'm healthy, have no pre-existing conditions, don't have a need to give birth because I'm a man, right? And I don't need to see a specialist. So if you ask me, Tony, what kind of insurances have you had in the last couple of years? They're short-term medical plans. I want to be covered in case something bad happens. And because I don't have any history in my background, there's no reason they won't cover anything that I need unless it's a specialist. But again, I have no pre-existing. So I don't foresee that. Does that make sense? I sell short-term medical plans a lot to people who tell me I don't want to spend $300 a month on health insurance. Because people who got to spend this much every month, can you imagine if you're healthy and your premium is $300 a month and you don't even see a doctor? I mean, you don't even spend that, not even one $25 copay on a doctor, but yet you spend $300 a month. Those are the types of people that would typically say, nah, bro, I don't want major medical. Just give me a short-term plan. $120, no problem. I'll do that. At least that person knows the most I'm going to pay out of pocket is whatever this number is, and then everything else is covered. I've had those plans. My last one had a $5,000 deductible, $6,750 max out of pocket. I knew the worst thing that could happen to me in any given year that I was covered is that I have to pay $6,700, and then the insurance company would pay 100% of everything else. That made sense to me because my cost out of pocket was like $100 versus getting a major medical plan and paying $300 a month. Because this you got to pay no matter what. This is only if you need the services. So I wanted this number to be low. Does that make sense? Okay. We talked about one, health insurance. Again, I can go more in detail, but that's for another training class. This gives you a good foundation. Now let's talk about ACA. What's the term stand for? Stands for Affordable Care Act. You guys hear terms in the street where people call it like Obamacare or Biden care or Trump care. It's all the same. It's all the Affordable Care Act. There technically doesn't exist Obamacare. There doesn't exist Biden care. There doesn't exist Trump care, right? A lot of people had a misconception that, you know, Obamacare was this one insurance company that was authorized by the government to provide health insurance. That's not what it is. The Affordable Care Act program is a government subsidy. What it basically is, it's called this line right here, income lines, right? And I'm just going to use hypothetical numbers. Don't take these numbers like Bible, okay? Because these numbers adjust when you run the formulas. The system tells you what they qualify, what they don't, and their age, you know, how many people, all that plays a role. But the biggest thing that lets you know if you qualify for the Affordable Care Act is your income, how much money you make. If you make too little money, let's call too little money $20,000 or less, you don't qualify for the Affordable Care Act, but you might be able to qualify for Medicaid. Medicaid is government insurance that the government pays for and the person doesn't have to pay anything at all. If you make 20K or less, you can qualify for this. If you're in this line, and let's call this line, you know, 20K to 40K. If you're in that line, in that spectrum, you can qualify for a government subsidy. What exactly is it? It's just money that the government says you can apply towards any health insurance that you want. Okay? Rob just said 12K or less in most states. So he knows more about it again than I do. He's telling you most states, this number here is not 20K or less, it's 12K or less. So again, that's why I say don't take these numbers for heart. Okay? But if you're here, if you're in between here, you can qualify for a government subsidy called the Affordable Care Act. If you make more than this number here, 40K or more, the government says you make more than enough money to pay for your own health insurance. So what you're looking for are people that fall in this bracket here. Now, there's a couple other things. There's a couple other things that the government has as a checklist to make you qualify in this. That's more than just income. One, your employer cannot offer group health insurance. If they offer group health insurance, you're automatically declined from the Affordable Care Act program. Two, if you're married, you've got to file taxes jointly. You can't do taxes separate. Got to be joint taxes. So as long as husbands and wives file taxes together, as long as there isn't an employer plan available, and as long as they fall between this income bracket, they can participate in the Affordable Care Act. And based on how many people they want to get covered, based on their income, the system will spit out a dollar amount. And that dollar amount could be anywhere from, like, let's say $100 to $500 a month. And what it basically is the government saying, hey, listen, we're going to give you a $500 a month government subsidy. Go get health insurance from any provider out there. Aetna, Molina, Cigna, Blue Cross, any of those major medical companies that you know of, we're gonna pay up to $500 worth of that bill. We're gonna pay it for you. You can pick the company you want. So if the insurance costs $650 and we're gonna apply $500, guess what? You only gotta pay $150. If the insurance costs $400 and you have a $500 monthly subsidy, guess what? Your insurance is free, $0. So can someone qualify for free insurance? Yes. Now, something you need to know. At the end of the year, the government wants to look at that person's taxes and they want to verify whatever dollar amount it is that the person said. As long as you're within scope of that dollar amount, this government subsidy stays in place. But if you tell the computer system, this person only makes 30K and they come out making 80, the government says, hey, we're going to take away this government subsidy. You now owe us this money back. So just understand it. But this Affordable Care Act program is huge, huge. Or if you've gotten unemployment, you can get more subsidy. That's right. That happened this year, if I'm not mistaken, Shelly, right? So if you actually qualify for some level of unemployment, the government's going to actually increase your subsidy. That's something that the government offered because of the huge level of unemployment issues that were going on because of COVID, the pandemic, and so on and so forth. So it's a good pointer. But this Affordable Care Act, guys, is huge. Now, let me tell you how I leverage this for sales. Because that's really the point of this training today. It's not to show you how to sell health insurance, although you can build a pretty decent health insurance business, right? It's how do you leverage this for cross-selling? So what do? I go on social media and I advertise, hey, is anybody interested in qualifying for free health insurance? Hit me up. You know what people do when they hear the word free? I want. That's why supermarkets love to do those little giveaway stations, right? I mean, if I got to pick between Sam's Club and Costco, I'm going to Sam's Club because Sam's Club have more little, free sample booths than anything. People want things that are free. So you advertise on social media, hey, anybody interested or looking for health insurance at $0 cost for free? Hit me up, send me a DM. What you're going to do then is you're going to plug them into the computer system, right? And the system will tell you if they qualify, right? And the information you're going to plug in is the person's age, how many dependents. It'll ask you some questions. Does the person have employer insurance, smoker, non-smoker, because that also affects the rate of the coverage. What zip code they live in also affects what they can qualify for. And then how much income they make, which is the biggest thing. And what happens is that you plug in that info, the computer system says, boom, you qualify for $500 a month, or $200, or $100, or $50. It'll tell you. From there, the system will actually show you a list of health insurance companies that are approved in that particular zip code. And now it's just a matter of finding the right one that makes sense for the client. But here's how I cross-sell. I advertise, they tell me I'm interested. Perfect. My first question with them is this, and guys, take notes on this, okay? Take notes on this because these scripts are the ones that are valuable. Rob has a whole different angle that he goes. I'm going to tell you right now, it's worth learning it. It's worth reaching out to Rob and be like, Rob, I got a health case. Can we work this meeting together? I really want to figure this piece out. I want to see how you're doing it. Here's how I do it, okay? And I'm literally a lot less available than Rob is, but I'm showing you what I do. I'll tell the person this. I say, look, we're going to try to qualify you for free health insurance. We're going to do our very best that we can. And I've helped many people do it. But I need to know before we move forward, if it does cost you something, what's your maximum monthly budget? I want to know what that number is. Most people tell me when I ask them that question. You ready? The most I can afford is anywhere from $100 to $150. So most people tell me, what do I now have? I know their budget. I know what they're willing to pay. 100 to 150 bucks. I then put them in the system and I see what they qualify for. You know what's crazy? A lot of times it ends up being like pennies, $1, $2, 10 bucks, 15 bucks. Something so cheap, something so low for a very good, high quality type of a plan, to be honest with you. But I know they told me they can afford 100, 150 bucks. So now what I'm going to do is I'm going to cross sell. You know what I'm going to cross sell? I'm going to sell them a dental plan, a vision plan. Why? Because those policies will pay you, the field, 150 to 300 bucks in commissions, because that's not included in the major medical plan. There's companies that sell what's called standalone dental and vision plans. I'm using a company called Emeritus, but there's many other ones. And if you want to get contracted in the health space with any of these companies, let me know. We've got the contracts ready to go. We've got them ready to go. Okay. But that's a cross-selling opportunity. You know what else I'm going to leverage now? The deductible. I'm going to tell the client, Mr. Client, your deductible is $5,000. If something did happen, something horrific happened and you ended up in the hospital, does your family have the $5,000 or do you have the $5,000 to pay in order to receive medical treatment? You know what most people say? What do you think most people say? You see Irvin's head right now? Nope, I ain't got it. Nope, I don't got it. So what's my language then? Mr. Client, would you be interested in some deductible insurance? Wait, what? Yeah, would you be interested in an insurance policy that'll pay that deductible if something happens? What do you mean by that? Well, we have insurances that'll actually give you lump sum money that'll help cover that deductible so that you can use that money to pay the deductible so that this major medical plan could start paying all the rest of your expenses. Would that be of interest to you? Yes, it would. Anybody know? Well, let me not ask that question. I'm just going to tell you what it is. What products can you sell at that point? You ready? You can sell standalone critical illness plans from Mutual of Omaha. You could sell a term life insurance policy with living benefits, because living benefits has what? Chronic and critical benefits. So if the person develops cancer, the doctor's going to want that deductible first. Well, cancer is a critical illness that a term life insurance policy will gladly give some cash to the client for it. There's medical expense plans. A medical expense plan is a policy that you make a monthly payment towards it, and there's a list of things that if you develop that particular condition, the insurance policy will give you a lump sum of money. That's what they'll do. There's also plans called gap plans. These gap plans will literally pay the deductible, and you're basically saying, hey, you're telling this insurance policy, hey, I have a $5,000 deductible on my major medical plan. So give me a $5,000 gap plan. I'm going to make monthly payments. And if I need to use it to pay the deductible, you're going to give me the cash to do it. At the end of the day, guys, it's cross-selling. It's cross-selling. The biggest hurdle someone has in health insurance is the deductible. That $5,000 deductible, that $65,000, that $10,000 max out of pocket. Those numbers will scare the person. But if they gave you 100 to 150 bucks a month that they can afford, and their major medical plan only costs 50, you still have $100 now you can play with. Out of that $100, you can pick up a critical standalone policy. You could pick up a dental and a vision plan. You could pick up a term life insurance policy with living benefits. You could pick up a gap plan, any of those that I just mentioned. And those little policies are 20 bucks here, 25 bucks here, 30 bucks here, this here. And you literally find another $100 a month worth of premium. And you were able to leverage it. In a perfect scenario, I just had this recently happen. Client said to me, I can afford 200 bucks a month. I said, perfect. Let me tell you the areas that I specialize in. I tell the client, I go, look, I help people with dental coverages, vision coverages, major medical insurance plans. I help people with life insurance protection and retirement planning. Which of those are you interested in protecting? You know what he said to me? All of them. I said, okay. So if I can get you all of these things covered and stay within your $200 a month budget, you'll do business with me. Absolutely. Okay. You know how much is government subsidy qualified him for? Free health insurance. Free. Zero. So now I had 200 bucks a month to play with. You know what I did? I put him into a dental and a vision plan, which total was like 65. So now I had $135 left over per month. You know what I did with 135? I put him into an IUL with NLG. I put him into an IUL with NLG. And you know what ends up happening with that IUL with NLG? It's kind of cool, right? I got him life insurance, I got him living benefits, and I got him retirement plans all covered in that one plan. So $135 a month. He was in his early 20s, so I ran it right at target. $135 a month times 12 was $1,620 in annual premium. At a VP level, you get paid at a 95% contract. That's $1,539 in commissions just out of that one plan. Then you got the commissions that you make out of the dental and vision, which was another few $100. It was like $300 on top of that. So add $300 more to the $1,500. That's $1,800 in commissions that was made out of what? Mr. Client, if I can help you qualify for some free health insurance, would you allow me to? Here's what I won't do. I will not disclose that there's multiple policies that are being sold. Do not be that agent that likes to jumble things up and say, well, listen, I can get you free health insurance, but you got to get this as well. That, by the way, is illegal. It's a first step to losing your license. You're not going to commingle products together. You're not going to do that. You full disclose it. Mr. Client, what's your budget? My budget's $200. Okay. I help clients with dental insurance, vision insurance, health insurance, life insurance, retirement planning, disability. Which of those would you like to cover? I like to cover all of them. Okay. Great news. Your health insurance, $0. $0. Zero. Boom. Your dental, 30. Your vision, 30. Your life insurance with savings, your index universal life, 135, and it also has living benefits. It takes care of this, and this. Mr. Client, what would you like to do? Let's go forward. They know. Full disclosure. If you're not talking health insurance, you're shooting yourself in the foot. Guys, you're shooting yourself in the foot. 3 things right now that people want to talk about. They want to talk about this. And what these 3 things do is they give you an opportunity to build relationships with your clients and find other opportunities to cross-sell. You know what those 3 things are? Health insurance, credit reparation, e-commerce. Those 3. Those 3. And you might say to yourself, well, they don't pay that much. You're right, guys. But I'm going to tell you right now, if all you care about is your wallet, this business is never going to be for you. It'll never be for you. But let's talk facts about the business side of it. That health insurance will probably pay you $15 to $20 a month. That's what health insurance will pay you. Dental and vision might pay you $150 to $300 in commissions. Credit repair will pay you $50 to $100 in commissions. Right? E-commerce might pay you between $1,000 to $1,600. That's a decent commission for e-commerce. But now you're talking to people that, you know, they've got 30 grand put away and they want to invest. And we all know life insurance is what's going to pay the most. Life insurance for $100 a month in premiums is $1,000 in commissions. If I'm going to make $1,000, it's easier to do it on a $100 a month premium payment than it is on a $30,000 e-commerce investment. We get it. We get it. But I can tell you, these small little commissionable products provide such a great value. It allows you to build rapport with your clients. It then allows you to cross-sell. Mr. Client, can I help you with this? Can I help you with this? Can I help you with this? And the one thing you're selling, the most important thing that you're selling, the most important thing, you know what it is? Yourself. Yourself. Throughout that conversation, that journey, that building rapport, I want to help you just by showing your client that you're willing to provide them a listening ear. Mr. Client, tell me why you're looking to get health insurance. What are you trying to protect? Mr. Client, tell me, you know, what are you trying to accomplish for your retirement goals? Tell me what your vision is, what your goals are. Mr. Client, can we do a budget so that I can make sure whatever I recommend to you is something that's suitable within your budgetary needs? Mr. Client, if something happened and you're no longer here, is your family protected, or would you like to make sure that there's enough money put away to protect them? Mr. Client, God gave me 2 of these, 1 of these. I want to learn about you today. So tell me about yourself. You'd be amazed how much building that rapport with that client gets them to open up. And when they really, truly open up, they'll tell you everything, and then they'll refer you to everyone. And you've created what's called a sticky client. You know what a sticky client is? A client that buys health insurance from you, retirement plans from you, credit repair from you, life insurance from you, health insurance from you, all of the client that buys all of that stuff, it's really hard for that client to untether themselves. It's really hard because they've got so many products and services with you. You are now their go-to person. But you know what you also did? You took that person off the market. Because I'm going to tell you right now, if all you do is sell your clients life insurance and you don't take care of their health insurance, there's a health insurance agent next month that's going to try to sell them health insurance and going to try to cross-sell and also sell life. So you're constantly going to be worried about the retention of your client because you're giving them the room to go talk to another agent who has a license. Why? I don't want to give that. I don't want to give my client reason to go to another person. I'm going to take care of your needs right here. I got you. And if it's not me, there's a partner within TKO's financial network that I'm going to connect you with. And we all have enough mutual respect for one another that you're not going to see that type of business happening. But you think that selling them life insurance protects you from that person leaving you if you don't take care of their health insurance? Their health insurance agent is going to try to sell them life also, guys. And if you're selling health insurance and not trying to cross-sell life, I promise you, your life insurance agent is going to try to take that health business. So you create a situation where you take care of all their needs. Same thing for credit repair, same thing for e-commerce. Does anybody have any questions about that? Give some love, give a shout out to Steve. Steve just passed his insurance license out in Pennsylvania. Give the man some love. Appreciate you. Wait, is that correct? Just Steve, J-E Steve, is that correct? Not sure.
That's Jeffrey.
Jeffrey. Okay, Jeffrey, congratulations, my friend. You passed. Listen. Let me tell you something. This is my designation for my CLTC. I'm CLTC designated. This is my insurance license. Another one that you don't see up here is my degree. I have a degree in business management. Okay. My degree cost me close to 6 figures. And my degree gave me 2 years of a salary at $42,000 a year working at a bank back in the day called Wachovia Bank. If you guys remember, now they're known as Wells Fargo. That's all that $100,000 degree gave me. 2 years at $42,000 a year. This insurance license cost me $150. This insurance license has paid me close to $3 million in the last 15 years. This $150 license gave me a lifestyle, gave me a career, gave me a business. My business management degree gave me $42,000 a year for 2 years. So congratulations. You just got a license that could pay you millions of dollars every single year for the rest of your life and leave behind millions of dollars to your family because you're building a business of passive income. You know what it is to build an agency with 3,000, 4,000 licensed writing agents? And you literally just put it in your will. Hey, I'm passing my insurance business to my family. Leave it for my son. And the only thing your son needs to do is get that license. So the moment your son passes that license and pays $150 and passes the license, your entire book of business passes over and your entire your overrides for your agents pass over. That's the power of that license you just got. So congratulations, my friend. Congratulations. What you do with that license now, 100%, my friend. What you do with that license right now is either going to be very big or very small, but it's 100% on you to be able to do it. We're here to help. Anybody have any questions in reference to what I trained today with health insurance and cross-selling? Okay. Here's your call to action. Here's the call to action. I want you to make it a point 3 times a day for 7 days to post on all of your social media platforms the fact that you have solutions for health insurance. Because one of the tip I'm going to give you, normally this Affordable Care Act is during an open enrollment period, which typically runs October to December. After that open enrollment period, someone needs to go through what's called a qualifiable event in order for them to reopen this. Let me tell you, the list of qualifiable events is pretty large. It's easy to find ways to get them to qualify outside of that enrollment period. So don't think, oh my God, I can only capitalize from October to no. The rookies will only try to capitalize from October to December. The rookies. But someone that's a player in this industry who really wants to, help families in the magnitudes and wants to provide a multiple 6-figure life for their families, they're talking about this all year long. So what's your call to action? 3 times a day for 7 straight days. I want you to go on every one of your social media platforms. And I don't care if you're posting the same stinking advertisement. I want you to say, is there anybody in my platform that's looking for free health insurance? Question mark. Say it however you want. English, Spanish, change the words around, but the message needs to be that you have a solution for free health insurance. And when you get that lead, when that person sends you a message, I want you to schedule a meeting. And then I want you to reach out to Rob Raw and say, Rob, I got a meeting. I have no idea. I only learned about 20% of what Tony taught me. I think he was talking about the Affordable Care Act. I don't even know. I think I spelled it wrong. ACADA. I don't care. I don't care. If the only thing you learned in today's training is I want you to advertise 3 times a day for 7 straight days on all of your platforms, LinkedIn, Twitter, Instagram, Facebook, Snap, everything on your news feed, on your stories, because believe it or not, different people watch your stuff in different places. I've learned on Instagram, some people watch my stories more than they watch my feed. Get on both of them 3 times a day for 7 straight days. And I promise you, at least 2 people will reach out to you and say, wait, what do you have? And then you say, yes, I have a solution for you. When can we talk for 20, 30 minutes? Set up a time, set up the appointment, boom. Are we able to get on a Zoom and have the meeting? If you're willing to take it a step further and get a Zoom meeting in place, perfect. And when you get that meeting, you're going to go on Voxer. You're going to tag Rob at ROB. Rob, I got someone on the hook. He wants to learn about health insurance. And I promise you the training that Rob will give you in the field is going to be 20 times better than what I just gave you in a classroom environment, because that's all he does. He takes health insurance leads and he finds ways to cross-sell life insurance, supplemental insurances, medical expense plans, medical reimbursement plans, dental vision plans. That's what he does. Allow him to go with you to the field and learn. Allow him. But you got a choice. You go by yourself, you figure it out. You take him with you, split the business 50-50. 50% of something, in my opinion, is way bigger than 100% of nothing. But what you're paying for in all reality is the education, the intellectual property. Because once Rob teaches you how to do it, you're never going to need him again. Now you take that information and you recycle it over and over and over and over and over and over, and it makes you an investment over and over and over and over and over and over and over again. But that's my best advice for every single stinking one of you. 3 times a day, 7 days a week on every platform. Hey, people. Hey, my Facebook friends. Hey, Instagram. Are you in the market for free health insurance? Hey, is anyone here looking for free health? Post it. You'll see messages come through. The killers, out of everybody here, I'll give you a prediction. 20 people here, right? Watch. 10 of you won't do it 3 times a day for 7 days. 10 of you will only do it for 3 days. 10 of you will only do it for 3 days. 5 of you will do it for the straight 7 days. Every day for 7 days. And out of the 5, one of you will go a step further and add at least 10 to 20 new friends every single day to your social media platforms. Only one of you will do that. Only one of you will do that. Only one of you will join some mom groups, some single dad groups, some retiree groups, some veteran groups, something that you relate to, and advertise there as well. Only one of you will. That one person will make more money than all 20. The 5 that do it for all 7 days will make more money than the other 15 who don't. The 10 that only do it for 3 days might make 1 sale. And the other 10 of you who are on here right now that won't do a single thing that I just mentioned to you, you're literally intentionally saying, Tony, I'm not even listening to you. You just wasted an hour of your day learning something that you're not willing to apply. That's the reality, because there's no better coach than life. There's no better coach than just life. I'm going to stay on for another minute or 2, guys. I wish you guys the very best of evening. I wish you the very best of the next quarter. I just had an intense meeting with a handful of guys earlier today that I believe is going to take this last quarter of the year to a whole nother level. Because myself right now, I'm ready to run. If you feel like running, if you feel like making sure January 1st you walk in and you're like, man, I made more money the last 3 months of the year than I did all year long because I ran with a guy like Tony and I was ready to make things happen. I promise you this next quarter is the quarter to do it. This next quarter is the quarter to do it. I'll meet you at the 50-yard line, but you got to meet me as well. If you got to make me walk to your house and wake you up and tell you to clock in, I promise you this is not it. I'm not that guy. I will meet you at the 50-yard line at 1 a.m., 2 a.m., 3 a.m. in the morning, but you got to get up and meet me halfway. You got to show me that your goals and your dreams and your family care, that you care about those more than I do. Because if I care more about your success than you do, I promise you that you might make a decent commission 1 week, a decent commission 1 month. But if I got to be the catalyst to activate you, you're not going to win success. You're not going to be successful long term. My biggest catalyst is me internally, me in here. My kids that I see every day, my Sandra that I see every day, her kids, that's my catalyst. I don't need to be motivated. That's why I'm willing to tell you, I'm here to meet you at the 50-yard line every single day. The question is, are you going to get up and you're going to meet me? If you're there, I'm ready to go. Have a good one. Be blessed. Like I said, I'll stay on for another minute for any kind of questions that you guys have. In 5 minutes, I will tell you, we will be beginning our full-timers. For those of you who don't know, we're moving our full-timers from Monday morning to evening hours because I want the West Coast to get a chance to participate. If you did your numbers, great. We're going to go over them. If you didn't do your numbers, but you want to start being a part of it, hang out at 10:15. We're going to do our full-timers. We're going to stay on this exact Zoom, okay, just so you know. And for those of you who don't even know what it is, but you want to learn, stay. We'll learn it for a quick 5-10 minutes and then make sure that we get ready for it. Be blessed and bye-bye.